Welcome to Mountain Health Today, a program that's brought to you and produced by the Tahoe Forest Health System. I'm your host, Ted Owens, and today we're going to be talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, and we're going to be talking about Level 3 trauma. Harry, good to see you. Welcome to the program.
Thank you. It's good to spend some time with you.
Well, we have a lot of time to spend today, Harry, and we're going to talk a little bit about Level 3 trauma. Harry, what is a Level 3 trauma center? What's a Level 2 trauma center? Let's start there.
Sure. To share with our audience, there's levels 1, 2, 3, and 4, and then other hospitals may have no trauma designation at all. The level 1 is typically an academic medical center that also does research and has a rich array of specialties and providers in-house 24/7. A level 2 is similar to a level 1 trauma center, except it's not necessarily an academic medical center and doesn't do research, but still has a wide variety of specialists in-house or immediately on call. A level 3 is slightly less acute, and that is the designation we're pleased to share with our community. And this means that we do have a wide variety of skilled services, but not quite the number of specialties or subspecialties that a level 2 might have. And then level 4 is a lesser variety of certified services.
Harry, let's have you take us through the process that Tahoe Forest Health System went through to arrive at this achievement. What was it you had to do? How long did the journey take?
Our journey was extended because of the COVID pandemic by probably at least a year or so, but typically thoughtful health systems will work on an exhaustive list of hundreds of trauma life support criteria. Trauma care in America is very thoughtful, it's very standardized, so the treatment processes and outcomes can be compared across many trauma centers in America. And so there's hundreds of criteria that we began preparing for to make sure that we understand all of those issues. And then in addition, all of our physicians, all of our nurses, and other personnel that are going to be working in and around a trauma program, they go through advanced trauma life support training as well, which is training that isn't necessarily common to physicians and nurses who might treat a patient and don't have this training. It's very, very important from a patient safety and good outcome perspective that patients, where possible, if they have that blunt injury or sharp injury, go to a certified trauma facility. Another key aspect is that we have these skilled individuals in-house, or we have them on call, such as surgical services teams or orthopedic surgeons or general surgeons. If they're not in-house, that they have to be available within X minutes to meet certified criteria of a trauma center. So that, coupled with the training, really delivers a much greater enhanced variety of care for a trauma injured patient than should they go to a non-certified trauma center.
And Harry, just two questions here before we have to go to break. How many people comprised the team, and how long did it take to get through to accreditation?
The number of individuals that went through training probably exceeded at least 50 individuals, and it took probably a couple of years to complete this great process where we were validated on March 11 of 2022.
Harry, so just real briefly, I think in the next segment we're going to drill down a little further into what types of situations you're able to serve the public in, but what generally is covered under Trauma 3?
Under Trauma 3, we can We provide advanced trauma life support. We can provide any evaluation, treatment, stabilization of patients, and we provide a wide array of diagnostic services. And we'll go into, just how an examination by a skilled team is very different in a trauma center versus typically a non-trauma center.
Okay. Well, we've been talking today about level 3 trauma here on Mountain Health Today, and we're going to come back to that in just a few moments. This is a very important topic, and Harry, in the health system, this new designation is serving what particular area, just so the folks at home know?
Our level 2 trauma center really serves the North Lake Tahoe region. There are 2 level 3 trauma centers in our entire region, one in South Lake Tahoe, and we in the North Lake Tahoe region. And so those are the 2 facilities that immediately serve this wide region.
And we've been talking level 3 trauma here on Mountain Health Today. We'll be back in just a moment. Thank you for watching. Welcome back to Mountain Health Today. I'm Ted Owens, and today we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. We've been talking about level 3 trauma. Harry, this level 3 trauma center verification is a vital step to serving the healthcare needs of the rural community. But what type of injuries and examination processes might someone go through should they need emergent care at the trauma center?
Sure. There's generally 2 major types of trauma that people will experience, and we're not talking or focusing on psychological trauma, but there's blunt force trauma, which could be where somebody has had a slip and fall of some type. They've had an off-road or on-road accident. They have had maybe a crushing type injury. It could be even an assault where a person has been kicked or punched. And so these are all carefully evaluated and categorized as blunt force traumas. And then there's sharp penetrating types of trauma, which could be involve a shooting, a stabbing, falling and getting hit by a sharp object. And those are also carefully categorized. And they're also categorized in levels of acuity from 1 through 6, with levels 5 and 6 being extremely life-threatening. And one of the beauties for patients in our region to know when you're coming into a trained team in a validated trauma center is they know that they need to check out all body areas generally, and not just the area of complaint, because there can be significant and even possibly life-threatening injuries in another body area that's not even being complained about. And so a non-trained physician team or nurse team might not know to look for that, but that's standard training in advanced trauma life support work, which is really valuable for our patients.
Harry, so if you have a patient that presents in the ER due to trauma, but it requires a higher level of care than a level 3 trauma center provides, what happens in that situation?
That's a great question. And as a validated trauma center at level 3, we're required to have transfer agreements in place for higher acuity levels of trauma centers. And we do have that in the Reno place where Renown Health is a level 2 trauma center. We're happy to have them in our broad region as a level 2 trauma center.
Are they the only transfer site that you would work with, or any other sites to the west, any other health systems?
We can also, to the west, Sutter and Roseville would also be a level 2 should the Reno area be fully occupied.
Okay, I'm going to switch gears a little bit, Harry. This is a great achievement for your team. They did a lot of very specified and hard work to achieve it. What happens now in terms of continuing education and maintaining that verification?
Right. Every year there is continuing advanced trauma life support training that's required for all individuals. Another thing that happens in a trauma center is that there's a trauma log of every trauma patient that's treated. There's a special trauma committee. There's a special comprehensive quality assessment process that always looks at how can these be handled better for optimal outcomes in the future. And these are processes that do not exist in non-certified trauma centers. So it is a very rigorous process and resources that are made available that don't happen in non-certified trauma centers.
Harry, obviously, if somebody is injured in an automobile accident, what have you, EMTs make the decision as to whether they go to the emergency room, the trauma center, correct?
That's correct.
Might people have other conditions where an EMT is not involved who might need emergent care? How do they know?
A traumatized patient may not always be first seen by an EMT, but even EMT individuals are trained on how to categorize this person in the field as to a level of trauma. And so they can make decisions as they call into the regional trauma communications line and say, okay, this level, let's say it's a neurological or a spine issue, that may need to go to a level 2 or level 1 trauma centers. Neurological or spine are the two major areas that go to at least a level 2 trauma center.
Okay. Now, when we come back in a moment, we're going to talk a little bit about what types of symptoms some folks might experience that might drive them to the trauma center. But before we do that, you have emergency rooms in 2 locations, correct?
That is correct. Our level 3 trauma center is at Tahoe Forest Hospital, 10121 Pine Avenue in Truckee. And we have an emergency department at Incline Village, Nevada, which is not trauma certified, at 880 Alder Avenue, Incline Village, Nevada.
Okay, but if necessary, they could transfer over to the Truckee location if necessary. Correct?
That is correct. That is absolutely correct.
Okay. We've been talking level 3 trauma service line at the Tahoe Forest Health System. We've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. You're watching Mountain Health Today, and we're going to take a break and we'll be right back. Thank you very much for watching, Harry. Thank you very much for all the information. We'll see you just in a moment. And welcome back to Mountain Health Today. I'm Ted Owens, and we've been talking about level 3 trauma at the Tahoe Forest Health System with Mr. Harry Weiss, who's President and CEO of the Tahoe Forest Health System. Harry, just to recap, this spring, your team achieved level 3 trauma center verification, and we've been talking about what that means. Just real briefly, let's recap for the folks at home what a level 3 trauma center is, and then we're going to get a little more detail on symptoms that people might experience that might drive them to getting to the ER.
Sure. And What a level 3 trauma center means in simple terms is that our community can expect to see advanced trauma life support trained physicians, nurses, and other key staff that are specifically trained in all the very standardized and advanced science relative to trauma, so that you will get evidence-based trauma care when you come to our facility. When a patient goes to a non-trauma certified facility, you can't be assured of this. So as a level 3 trauma facility, we're able to evaluate, treat, and stabilize nearly all types of injuries, but the injuries that typically we don't handle or that we might refer on to a level 2 trauma facility would be spinal related injuries or neurological related injuries, but a level 3 can handle nearly all of the rest of the spectrum of trauma injuries, which is so important for our community to know.
Harry, we all know, and we talked about a little earlier, that if you are in an accident, for example, an EMT is going to determine where you're going to go. But sometimes folks may have other symptoms where they should, in a timely fashion, go to the ER or to a trauma center. Can you share with us what types of symptoms those might be that would make one really decide to go to the right place, the ER?
That's a great comment, and I would just provide an entrance to say that timely access to great health care is the most precious gift on this earth, and certainly having 24-hour emergency department services is what that's directly about. And so there is a long list of very important illnesses or injuries that our community needs to be aware of. And please do not procrastinate. If you or a loved one sees any of these symptoms, number one, if you're experiencing chest pain, if you're experiencing difficulty breathing, if there's a severe burn or uncontrolled bleeding, or if there's sudden or severe pain, vomiting of blood would be another example. An intense crushing headache should be immediately evaluated. Also related to that or unrelated, sudden dizziness or a change in vision, if there's been a loss of consciousness, if there are any seizures or convulsions, severe vomiting or diarrhea, a broken bone or a deep wound, and certainly fever in newborns under 3 months of age. This is a partial list of items, topics, clinical issues that patients should immediately seek out emergency care for.
Harry, we have a lot of wonderful folks that are second homeowners up here, may live down in the Bay Area, for example, at lower altitude. So sometimes difficulty breathing or dizziness can be caused because they're not used to the high altitude where Tahoe Forest is located. Should they still come to an ER, do you think, if they're experiencing those kinds of symptoms?
If this is something new for them, it's better to be safe than sorry. We recommend that they come in and get it checked and rule it out that it is a high altitude issue or not. Don't assume that it's nothing. Your life does matter, and we want to make sure you have a great outcome.
I think that's very helpful, because when I go down to the Bay Area at low altitude, I'm experiencing dizziness, but for different reasons. Harry, if you would, share with us some of the technologies that are in the ER. What types of technologies can people expect to find?
We have on site a very wide array of diagnostic laboratory services. We have an exhaustive list of diagnostic imaging technologies, including all types of X-ray, CAT scan or CT scan, ultrasound services, EKG services, et cetera, that are available to quickly treat our patients.
And those are available 24 hours a day, correct?
That is correct.
Okay, very, very important. Harry, once again, before we leave, you have 2 emergency rooms. You have a trauma 3-level center in Truckee. Would you give us the location of that and the emergency room in Incline Village?
Yes, our level 3 trauma emergency ER is located at Tahoe Forest Hospital, 10121 Pine Avenue, Truckee, California. And we have another 24/7 emergency department at Incline Village Community Hospital, located at 880 Alder Avenue, Incline Village, Nevada.
And Harry, is there if somebody has questions, is there a telephone number they can call or a website they can go to?
You can please go to tfhd.com.
And there's an information number there, I believe.
Yes.
Yeah. Okay, thank you. Harry, thank you so much for spending time with us today. This has been Mountain Health Today, and we've been talking about the Level 3 Trauma Center at the Tahoe Forest Health System in Truckee, California. And we've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, thanks so much again for being with us.
Thank you.
And for the folks at home, thank you for sharing your time and tuning in. Appreciate it. Bye now.